Hello, good evening and welcome to the RCSI University of Medicine and Health Sciences. My name is Dr Ciara Kelly and this evening we're going to be talking about childhood vaccinations and their importance to human health. This topic will also be covered in the MyHealth series of public lectures that the RCSI are holding, and that series aims to bring together top researchers and practitioners in different fields to help equip people and empower them to make good decisions about their own personal health and well-being. Joining me around the table this evening we have Professor Karina Butler, who is Professor of Paediatrics in UCD and Chair of the National Immunisation Advisory Committee. Professor Sam McConkey, Department of International Health and Tropical Medicine, RCSI, and Professor James Paul O'Neill, Professor of Otolaryngology, Head and Neck Surgery at RCSI Beaumont Hospital. Sam, I might come to you first of all. We're talking about vaccinations. Just for people, I suppose, who are out there, maybe even in the live stream, what are they and how do they work?
I think vaccines have been I would call them a transformational technology, a bit like something like the internet or like electricity that have completely changed our lives. The positive examples I'd give are the polio control. Polio used to be a horrible disease. It was affecting and paralysing many people, and now it's largely under control. Similarly, smallpox, through vaccination it's eliminated smallpox. So a few dramatic successes, and many of us believe that we could do that for other diseases.
And what's the evidence that they work? Like, how do vaccines work? How do they prevent us from contracting diseases?
So they work by harnessing the human immune system, and our bodies, as everyone probably knows from chickenpox, once you get it once, you've got protective immunity, so you don't really develop chickenpox typically a second time unless you're very immunocompromised. And the vaccines trick your body into thinking that you've seen it before when you haven't really seen the real disease before. They make your body think as if you've seen it before, and then your body reacts in a very powerful way if it sees it a second time, it thinks, but really it's seeing the disease for the first time.
Okay, so it sort of mimics that you've had a disease and then you develop antibodies so you don't get it the second time. Sounds fantastic. Sounds like it's a no-brainer. Everyone should be vaccinated against all sorts of things and it's a win-win. But let me bring you in, Karina. That isn't always how it works. Lots of people are opposed to vaccinations. Can you explain to me why that might be?
Well, lots of people may not get vaccines, and I think the first thing to say is most people, most parents want to do what's right for their children. And so there is a wide spectrum of people out there who may not get their vaccines, and they vary from those who consider themselves informed and are really misinformed about vaccines and don't want to do it. And then there's another wider group for different reasons in life don't get their vaccines. The WHO have really characterized it into three groups, which is very useful. They look at the 3 C's, so confidence, complacency, and convenience. Now, convenience, we all know that lives are busy, especially people who've got young children, parents trying to deal with creche and school, and sometimes it's just not convenient for them to go, or it's not in their life priorities. So that's where I think as a society we need to really do everything we can to make getting vaccines easier, sort of following the nudge theory. Complacency. Some people believe we don't need these vaccines anymore. And we've just heard Sam talking about diseases that are gone, but we have to remember there's only one human disease that we've eradicated, and that's smallpox. And if we go back in time, for example, even in the 1930s in Ireland, there were hundreds of people every year dying from diphtheria in Ireland. And if you go back a little bit further, there were that number dying from smallpox in Ireland. So these diseases, apart from smallpox, are still there, and if we're not protected, they will come back. And we've seen evidence of that. For example, when there was disruption to healthcare systems, where there's war or where there's migration and movement, we see all of these diseases resurging. And then the third thing is confidence. And I suppose that's the bit that fuels the people who feel they're informed and don't want to get vaccines. They basically have lost trust in the healthcare system. They've lost trust in the vaccines. And part of that is fueled by misinformation that is out there. So they're the areas we have to target.
There is something of a difference between the vaccine hesitance, the vaccine hesitancy,
yes,
and the anti-vax movement, which is actually a movement. There is a group who campaign actively against
Absolutely.
vaccines and attempt to undermine the public health programmes of various vaccines. And MMR was a good example, and we'll get on to HPV in a moment.
Yes.
Can you just explain the difference between maybe vaccine hesitancy and hardcore anti-vax sentiment?
Well, I think if you look at people as a kind of a spectrum, and at one of that end of that spectrum, you have the people who will go along dutifully, they trust the healthcare system, they accept all the vaccines that are offered to them. At the other end of that spectrum, you have that hardcore who their beliefs are that vaccine is wrong. Now, what fuels those beliefs is very different, and we can come to that further if you like. And then in between those, there's a spectrum of people who may accept some vaccines, not others, who just don't get around to it, who have their confidence. They basically want the best, they believe the healthcare system, but they have their confidence shaken by something like what happened with the HPV vaccine, and they're holding back, they're waiting. So that whole spectrum where someone doesn't get their vaccines on time in the schedule is referred to as that hesitancy group. So vaccine hesitancy. And I suppose one of the things that we want to do is to reach out to that group, to give them the information, to help build their confidence, to answer the questions that they have, and therefore to empower them to make an informed decision about getting the vaccines.
Paul, we hear a lot about the HPV vaccine in relation to cervical cancer, but you're a head and neck surgeon. Why do you have an interest in the HPV vaccination programme?
Yeah, so to have a new disease in your specialty is something that you don't expect. And in 2010, there was a paper that was published that basically showed the impact of HPV disease in oropharyngeal cancer. So what's oropharyngeal cancer? It's base of tongue and tonsil. And what actually was happening during the 2000s is that survival was increasing for oropharyngeal cancer. And we were thinking to ourselves that we were just treating it better, but we weren't. We were treating a different disease. So we've got two streams of disease cancer in head and neck. We've got a chemical carcinogenic driven cancer, smoking, drinking, and we have a viral driven cancer being the HPV. So that's the reason why now, in terms of HPV, are we interested in it? We certainly are. And in fact, in a recent audit looking at oropharyngeal cancer, looking at 2009 to 13, 2014, 2018, there's been a 37% rise in oropharyngeal cancer in Ireland. Of that 37% rise, nearly 50% was directly related to HPV. And of that 50%, 80% were men. Okay. So we're seeing this is a viral-driven cancer, predominantly men, as opposed to in the anogenital region where we hear mostly about women. But actually, if you look to the United States now, oropharyngeal head and neck disease has now surpassed cervical cancer.
Okay, so we are actually looking at a huge tranche then of cancer patients. The HPV vaccine has been rolled out for boys, or is about to be rolled out for boys in all of the rest of the country. That, I presume, you would welcome then as an important tool in the arsenal against head and neck cancers. There's now 84 countries around the world that are giving the HPV vaccine. 270 million doses of this vaccine has been given. This is a no-brainer. We have consistent results all around the world showing that not only is it highly effective, and we're talking about preventing 100% of cervical infections, vulval infections, vaginal infections, the predominant subtype being HPV type 16, but also that it's safe. And you look at the WHO, their 7th round of vaccine research. The last one, there were 75,000 people investigated. You look at the United States watchdogs, you look at the European Medicines Board, you look at our own watchdogs, you look at watchdogs in 84 countries around the world coming up with the same answer. This is safe and it's highly effective. It was a whisper 10, 20 years ago we would one day have something to prevent cancer. Now we have it. It's a reality. And when you hear Paul say that so strongly, Sam, does it frustrate you that doctors, surgeons are saying, you know, we longed for a cure for cancer. We hoped and prayed and worked towards some kind of prevention of cancer, and now we have it. And yet at one point the HPV vaccination rates in this country, and HPV, let us remember, prevents 4% of all cancer, or causes 4% of all cancers, they fell to 50%. Is that very frustrating?
I think there's a need for really public education and reassurance and teaching and good healthcare systems to make these easily available to all of the boys and girls that can benefit from them. So I see it as a health systems challenge of education and developing confidence and trust between patients and citizens, if you like, and the healthcare system, that the healthcare system's actually giving them good advice. So I see it as building trust, building relationships of trust between healthcare professionals and the people who come to them looking for advice. So a lot of it is down to building trust.
Okay, and I think trust is key in this. What do you say to people, because it's said quite a lot on things like social media, which I think drives a huge amount of the misinformation, but you can't give all those vaccines at the same time. The immune system won't cope with it. Don't give them 6 vaccines in one, spread them out, give them separately. A lot of people want an ad hoc sort of bespoke vaccination schedule.
So that's a really sensible sort of consideration to say, can you give a 6th vaccine when you're already given 5? And it turns out in Ireland we've got a national regulator who looks at the safety of medicines and answers and analyses scrutinises in great detail the safety and efficacy of the vaccines. And whenever a new one comes along, they will actually ask for data, for results from real people to see if you give 5 now and 1 later versus 6 altogether, did the 6 work just as well as the 5? So the people are quite right to ask that question. It's a really sensible question, and lots of people have looked at that question and provided evidence with the controlled studies to see does it work, and it's good news that the 5 and 1, the 6 and 1 do actually work okay, just as well as giving those.
We know this.
Yes, this is looking at the evidence, looking at the data, observing. This is what science is about, observing the evidence of what happens when you actually do things. Is one better or not? And the answer is that when you do the experiment and look at those 2 alternatives that you've proposed, that actually giving the 6 and 1 is actually okay. So, and it's a really good question, and it has been answered.
And if it can be done in 1 visit rather than 2, you're more likely to...
Rather than 6, imagine them 6 little visits.
One of the concerns, though, that parents will express is they feel that putting it all together are too many stimulants for the immune system. And one of the things that I talk to them about is that actually what we give them in terms of the vaccines is minuscule compared to what a baby who comes from a sterile environment and gets born and is exposed to all the normal gut bacteria are exposed to. And now with our current vaccines, what they're given is, despite the number of vaccines have got much bigger, is much, much less than when we were giving just a single vaccine, for example, in the past when the original smallpox vaccine or something like that was. So they're much purer, they're much targeted, and the amount that is presented to the immune system is tiny compared to what we meet with every day. So there's no way that it can overwhelm the immune system.
So that's just people who maybe don't understand how the immune system works.
Yes.
I'm glad you mentioned babies being born, because we often push vaccines on women during pregnancy, the flu vaccine, whooping cough, things like that. A lot of people feel very conscientious during their pregnancy that they shouldn't take anything. They shouldn't have a glass of wine. They shouldn't take a paracetamol necessarily. Why is it okay to be vaccinated during pregnancy when we often suggest that other things shouldn't be given to pregnant women?
Well, first of all, people are right to be careful during pregnancy, and we all know that there have been problems in the past with drugs that were used that were thought to be safe. So that is a normal caution that is understandable. So why do we give these vaccines in? Well, first of all, they are established as being safe, and the risk to the mother who gets an infection like flu is much greater if she's pregnant than if she doesn't, because in pregnancy your immune system is lower, but also there are changes in your heart, your circulation, and in your lungs to accommodate this growing baby that make you much more vulnerable to the complications of something like influenza. So that's why we give it to women in pregnancy. That's why the flu vaccine is advocated. Now, the other vaccine that we want to give to mothers in pregnancy is the whooping cough vaccine. And that's because young babies, particularly in that first couple of months of life, before they've had the chance to get their own vaccines, are vulnerable. And that's the group who, if they get whooping cough, can die from it. And there is nothing more tragic than seeing a baby go home healthy and well, come back into the ICU, and particularly maybe a little premature baby who has survived that, comes home and then comes back in and might not even be coughing but is going blue, not able to breathe. And we don't have actually effective treatments for whooping cough. The best treatment is prevention. We do give antibiotics to prevent the spread, but they don't actually treat whooping cough.
So you can vaccinate the mum and
so we vaccinate the mother
confer.
For her antibodies to get across to the baby and keep the baby safe during that initial period, because whooping cough in the first 6 months of life threatens a baby's life. That's why.
Okay.
It's just like when you're saying there about the best way to treat is prevention. The best treatment for cancer is don't get cancer. So if you can prevent a dysplastic process, what's that? When you talk about CIN, cervical intraepithelial neoplasia, this process where you get an altered maturation of the epithelium layers inside your body, that process results ultimately for some people in an invasive disease. Once it's invasive, that's cancer. So if you can prevent that, well then you're not getting cancer. And you just look, that's what's happening with the HPV vaccine. You just have these spectacular results. Look in Australia, where you got 10 years of it. We're talking now about elimination of cervical cancer. Elimination.
Which is spectacular if you think of it in those terms. But you mentioned the safety profile of the HPV vaccine. What do you say to the people who say, well, I've heard about the 2 or 3 or 4, depending on who you talk to, 100 cases of teenage girls on suicide watch and I don't know where these girls are, but these girls who've had these drop attacks and they have chronic fatigue and a whole basket of symptoms that sound terrifying to parents that are being attributed to the HPV vaccine. That information, that misinformation keeps rolling out there. What do you say to people who've heard those scare stories and are afraid to vaccinate?
Okay, so the first thing is you have to distinguish between a side effect and an adverse event. An adverse event you can report about anything. Okay, that doesn't necessarily prove causation. What are the side effects? Are there side effects to HPV? Of course there are. If you give a shot of saline into someone's arms, salty water, you're going to have an effect. Okay, so what does it causes? Acute inflammation. So you're going to get redness, you're going to get pain, you get swelling, get heat, you might get a headache. Could you get a drop attack or get a fainting episode? You could. So we sit people down for 10 to 15 minutes after that. It's in a small percentage of people. Very rarely we could have a very serious impact, which is anaphylaxis. And the HPV vaccine is the most scrutinized vaccine of all time.
And anaphylaxis, for people who are listening?
It's an allergic reaction, a profound allergic reaction. That's exceptionally rare. We're talking about in the millions. In terms of what you hear about multiple chronic fatigue syndrome, you'll hear about complex regional pain syndrome, postural orthostatic tachycardia syndrome, autoimmune diseases. These are kind of things that you'll hear. And when you look to the literature and you look at evidence, okay, you look for evidence in the literature, it's not just my opinion, and you look for pre-licensure studies of the vaccine and post-licensure. They're independent of pharmaceutical companies. If you don't trust the pharmaceutical, you'll find the same things. There's no evidence to suggest that any of those, and they are real conditions, and there are children and adults with those conditions. And are we seeing more of those now in the post-vaccination than we did pre-vaccination? No. So that's called clustering. So are we seeing a cluster of these? No. And if we were, what would happen? These watchdogs would find it and they would be taken off the market.
Okay, so what you're basically saying is things like chronic fatigue, yes, girls who are vaccinated may have it, but girls who were never vaccinated also have it.
Exactly.
And there's no increase in the numbers who have it who have been vaccinated.
And boys, before they introduced the vaccine at all, also have it.
Yeah.
And when the European Medicines Agency looked at this, what they found was there was a significant incidence of chronic fatigue syndrome in that spectrum of diseases, and it was about 150 per million. It's not innocuous, but it was the same in children who are vaccinated as children who weren't vaccinated.
Okay. Sam, with regard to, we mentioned diphtheria earlier, there's also things like typhoid, there's all sorts of conditions that we're vaccinating against, many of which parents have barely ever heard of them because they're all but gone, if not completely gone. Why are we still vaccinating against diseases like that?
I think many of them are still circulating. Whooping cough, as Karina already mentioned, even though the disease in children is controlled by vaccination very well, it's actually circulating in adults, and we, every 5 or 10 years, continue to get the sort of barking cough that goes on for 3 or 4 weeks, and that is actually Bordetella pertussis whooping cough in a milder form because we're bigger and able to deal with it. So even though the disease is gone, the organism is still circulating, people are still getting symptomatic effects of it. Other things like tetanus, which most of us are vaccinated against, is living in the environment. So if we get our cuts and bruises and our rusty nails and so on, there still are rusty nails in our environment, and the disease is gone, but the organism's still there. So if people are to wander around without being tetanus vaccinated, they still have a chance of getting it. That's true for hepatitis B. You know, many of us are sharing body fluids with other people, and there's a significant risk of catching hepatitis B. So we now have a national hepatitis B program. I'm going to put in another word for anti-cancer vaccines, because we've talked about HPV as an anti-cancer vaccine, but around the world, in cancer in men, the biggest death rate is actually liver cancer due to hepatitis B, particularly in Africa and Asia. And I worked on this in Gambia for many years, and the hepatitis B vaccination program has been profoundly effective at preventing liver cancer in men in Asia, in China, and in Africa, where it's been done on a big scale. So we've actually 2 really effective anti-cancer vaccines. So, you know, Richard Nixon started this Conquer Cancer type campaign, and these are the results. These are the technologies that actually do prevent people dying and getting cancer. So I would add hepatitis B as another anti-cancer vaccine.
Do you want to know the ultimate irony? Is that the inventor of the HPV vaccine, Yan Zhu, himself and Ian Fraser, who came together, Yan Zhu died of hepatocellular cancer because he wasn't vaccinated. So he died of a disease which was preventable himself.
And vaccine preventable diseases, I suppose, are what we're all about when we talk about this. We have seen a huge rise in things like measles as well, on a global scale. Very frustrating.
I mean, we don't want people sometimes really have forgotten the impact of some of these vaccines, because I often think, even just in terms of my children's lifetime, not even my lifetime, but Haemophilus influenza, or when I was a junior doctor first, we used to get children with Haemophilus meningitis in every single time we were on call. And now we virtually never see it because of the hip vaccine. Then the meningococcal, when I came back to Ireland in the early 90s,
later, so.
and in fact Sam was working with me. He was
I was learning, she was teaching me.
And I remember Sam coming, and he would come back from Gambia, I think, at Sierra Leone at the time, and said, Karina, what's going on here? Look at all this meningococcal disease. We have to start collating these numbers, because children were coming in mottled blue, dying teenagers, young children with meningococcal C disease. And we, in just one hospital in Dublin here, had 59 cases in our children in 1 year. That's over one a week, okay? And now my registrar, I had a registrar the other day who is in her training, never seen a case of meningococcal C disease, because it's become that rare. That was the benefit of the vaccine that was
And the same with measles. I remember us being told how to identify measles because we never saw it.
Exactly.
Then, now it's different.
And now, because the incidence rates have fallen, we can look at the graphs across Europe where we see now, we're seeing back these epidemic waves of measles. And again, it's not innocuous. 1 in 500 to 1 in 1,000 people are dying, and the numbers that have died throughout Europe in the last year were very significant from measles. Thankfully, the uptake is coming up a little bit again, but we suffered so, when I say we, I mean us as a people, a population, following the Wakefield incident, because it took so long for the immunization rates to come back up again. And we're still, will wait to see what the long-term effects of that are, because don't forget, measles is also associated with a delayed neurologic deterioration, subacute sclerosing panencephalitis. And that only happens years after you've recovered from your measles. So I'm quite sure we'll begin to see some of those cases again.
And I think we are still dealing with fallout, even with all the regular outbreaks of mumps among college students and all of that. We talked a little bit, and I think I might ask both of you this, around what drives the beliefs, what drives the anti-vax belief. And the HPV vaccine has had particular targeting, largely because HPV is a sexually transmitted infection. I think that drives some of this. Talk to us a little bit about the beliefs that drive the anti-vaccination movement.
It is so varied, because if you go back in history and time, smallpox vaccination was introduced in the 1700s. And at that time, it wasn't a perfect vaccine, absolutely not, and there were problems with it. And there was the genesis of anti-vaccine movements, both in the UK and the US and here. And what you saw is that the anti-vax at that time came from different groups. There were the religious, who believed that this was interfering with the natural pathway. You were interfering with God's will. There were those who believed that actually you were interfering, which was the natural culling of those who were unfit to live. And then there was also the group who believed that you shouldn't be using animals, which were the cows, to generate the vaccine. So that was in there as well. Now, over time, it's interesting, there was a paper in that time by a guy called Malthus, and he listed all the reasons for anti-vaccine sentiment, including the fact that it was nature's way, that really we just needed better sanitation, that it was the survival of the unfit. And almost if you look at the reasons today, there are parallels. So there's that strain throughout time.
Because there is a religious, sort of far-right conservative Christian ideology behind some of the anti-vax movement on the HPV. They believe in abstinence, and that if you vaccinate people against an STI, you're encouraging promiscuity. What do you say to that?
Well, to be honest with you, the extremist anti-vax, I'm not worried about that, because no level of evidence is going to assist. So, good luck, fine. You have your opinion.
Are you concerned about them influencing other people?
It's the middle. It's where people are just concerned. Am I doing the right thing for my children? It's not that they're against vaccination. They're hearing these stories. Am I doing the right thing? Unfortunately, now with social media, science is just one voice in the room. Okay, so I can just say whatever my truth is. Now, my truth might be nothing to do with science, but what people have to realize is that if you are openly arguing, saying the HPV vaccine is not safe, okay, with the enormous quantity of information that we have to prove that it is, you're putting people and children directly into danger.
Okay, I have one last question because I know we're coming to the end, but I want to throw it to you, Sam. What do you say when people say, but is it not better to actually get the disease and have a strong immune system, you know, because you've been exposed? And people hear about the chickenpox parties where they lick the lollipops to try and actually catch certain childhood diseases from each other and all of that. Is there any truth in it being better to have a disease than a vaccine?
For the diseases we've been talking about, the answer is universally no. So getting polio is really a bad thing. Getting tuberculosis, getting tetanus, getting whooping cough is bad. There is something called the hygiene hypothesis, which a man called Barker in Southampton came up with. This idea that if we ate more soil and more exposure to helminths again, that maybe we'd have less asthma and allergic condition. That's a hypothesis. I don't know if it's proven. So maybe a good exposure of our immune system to some natural antigens is fine. I think growing up in a sterile environment that's no allergens and no bacteria isn't healthy. I think we have to live in the real world. So I think
we're vaccinating against these diseases because they're serious diseases.
We're vaccinating against very specific, horrible things, and we certainly don't want any of those. But I think having a good immune system just from normal life is what to do. So I'm okay with my child eating a bit of soil, but I definitely want them to get all of 25 vaccinations.
All right.
I have to come in and add to that, Sam, in the sense I think what was really shown and was illustrated by that absolute advocate for the HPV vaccine, Laura Brennan. And I think Laura got up there and showed herself at different stages through the horrors of cervical cancer. And as she said, she hadn't had the opportunity to get the vaccine, and she would not argue that natural disease was better. And she died just this month last year. Yeah. I mean, Laura Brennan did so much, but she really was the voice that said natural disease, be it meningococcal infection and ending up with amputations, be it Haemophilus influenza and ending up with deafness, measles and ending up blind or with neurologic deterioration, or cancer and dying, is not better than vaccines. And yes, the small discomfort of the side effects that are there.
You're absolutely right, and Laura Brennan was a good friend of mine, and I'm glad you actually brought her up. Look, that concludes the roundtable part of tonight's discussion. My thanks to the group here tonight, Professor Sam McConkey, Professor Karina Butler and Professor James Paul O'Neill.